Good morning, everyone, and welcome. I am Kimberly Hobson, the proud CEO of the Southside Healthy Community Organization, which we fondly call the SSHCO. We are happy to see all of you, and we're excited to share highlights of the work we've done and the progress that we've made. I'd like to make just one announcement. If anyone wants captions for this town hall, please activate your captions button along the bottom of your Zoom screen. And this captions button works for other languages as well, such as Spanish. And so we are 3.5 years into doing exactly what we set out to do, and that is to execute on the healthy community model, which is designed to develop an ecosystem that addresses health disparities and improves health outcomes on the south side of Chicago. For those of you who may not know who we are and what we do, I'll provide a quick synopsis of the SSHCO. We are funded through the generous support of our State of Illinois Healthcare Transformation Initiative. We serve residents in the 15 zip codes that make up the south side of Chicago who either have no insurance or are covered by Medicaid. We help these residents navigate the complexities of the healthcare system to get the support and services they need to live longer and healthier lives. We are doing this by bringing more doctors into the south side and thus creating increased access to appointments, helping to better manage chronic diseases and prevent illnesses, addressing key social determinants of health, such as transportation, food, and housing, as well as employment. We're also connecting residents to community resources and serving as a convener for our 15 partners, which include safety net hospitals, hospital systems, and federally qualified health centers, all connected to a unified electronic platform to support seamless care, which has been built as part of the Southside Healthy Community Organization. Now, SSHCO is meeting residents where they are in their individual lives and making key connections that build health and wellness. We are at 21 clinics and emergency rooms throughout the south side of Chicago. And we are now starting to also be directly in the community, not only at major events and health fairs, but also we're partnering with community organizations to be embedded into their organization and into their services. So 3.5 years in, I've told you the things that we've done. We can confidently say that the SSHCO residents who are connecting with us are benefiting from our services, and we think they are living healthier lives. And so a few highlights on our progress. To date, we have made more than 13,000 referrals and connections to community resources that address social needs, including food, transportation, job training, and supportive housing. We've served nearly 4,000 community members with a full slate of health and wellness social services. And we've also we have 75 members enrolled in maternal health coordination services, and we have provided more than 300 maternal fetal medicine consultants through our program at Friend Health, which is expanding to Chicago Family later this month. And we are seeing a notable decrease based on the work that we're doing in emergency room visits by those that have graduated or are currently enrolled in our program. In fact, more than 1,000 emergency room visits have been prevented. And I see this as true progress, of which I and my staff are proud of. So here's what you can expect today in this morning's town hall. We will hear from the director of the Illinois Department of Healthcare and Family Services, Director Lizzie Whitehorn. We remain so grateful, Director Whitehorn, for all of the funding we receive from the state to do this important work. I want to also note today is May 1st. It marks the start of Mental Health and Awareness Month. And so we have a panel discussion focused on this critical area of need. We will also share some highlights around our housing services, and you will hear from a patient on that as well. SSHCO has added nutritionist services to our food distribution work, and one of our nutritionists will share some updates and tips and tools for all of us to hear. And we have an exciting event coming up, our SSHCO second annual Empowerment Health Fair at the end of June, which is being put together by our Community Advisory Council, which we are so grateful to have. As a reminder, if you have questions, please put them in the chat directly to Bria Kelly, and we will leave time at the end to answer the questions that come into the chat. Well, thank you so much. As I mentioned earlier, the SSHCO is funded by the Illinois Department of Healthcare and Family Services. I would like to extend many thanks again to HFS for their support and generous funding. With us this morning is Director of HFS, Lizzie Whitehorn. Thank you. Yeah, Lizzie Whitehorn. So Lizzie will be joining us now.
Great. Thank you so much, Kimberly. And yes, I am definitely not a doctor, but work with many healthcare professionals. But it's nice to be with all of you virtually this morning to celebrate the great work of the Southside Healthy Community Organization, which, as Kimberly mentioned, is one of our Illinois Healthcare Transformation Collaboratives. This program launched 4 years ago with the goal of reimagining healthcare delivery in Illinois by breaking down silos and bridging gaps that exist in some of the most underserved parts of the state. We know that in order to have healthy communities, they need to be so much more than access to a hospital and other traditional medical care. It also means the availability of a broad spectrum of services that address a person's health-related social needs. Because if someone doesn't have stable housing or access to food, they won't be able to prioritize seeking preventative care or addressing other health issues. HTCs bring together a range of types of providers: hospitals, FQHCs, community health clinics, and community organizations that provide things like workforce, youth, and neighborhood development services. That work together to address whole person health. By coordinating services at both the individual and systems level and tailoring solutions to each community's unique needs, we can focus on addressing inequities in underserved communities across the state. We now have 15 collaboratives doing important work from the south side of Chicago to Peoria to the Metro East and Southern Illinois. When HFS began building this program, we commissioned a study of health disparities across several regions in the state, including the South Side, one of the most socially vulnerable areas of the state based on the CDC's Social Vulnerability Index. The South Side has a higher rate of disease and a lower life expectancy than other parts of Chicago. Access to quality primary and specialty care is critical for both prevention and treatment. I'm so glad to see how the SSHCO's work so far is positively impacting the Southside communities they serve. To address challenges with accessing high-quality healthcare on the South Side, as Kimberly mentioned, they have developed a care coordination model that focuses on primary care and specialty care access, as well as preventive and chronic illness management. SSHCO has also demonstrated a strong commitment to improving maternal and child health outcomes on the South Side and addressing the disparities Black mothers and babies face, which is a shared priority for the Pritzker administration. They're adding new providers and are embedding community health workers within the community to make screenings and subsequent referrals more readily available. By bringing in new local providers, SSHCO is expanding access so fewer Southside residents need to leave their community to find the care they need. Navigating the healthcare system can be difficult for all of us, and the community health workers, care coordinators, and other providers that make up your team are helping to meet that challenge and connect patients with quality care more quickly. At HFS, we are grateful for all you have accomplished and look forward to continuing to work with you with the goal of creating better health outcomes for Southside residents. Thank you so much.
Wow. Thank you very, very much, Director Lizzie Whitehorn. We are just so excited about the work that we're doing with the support and the funding of HFS. And so your funding could not be more helpful to not just myself, but to the entire South Side and the entire state of Illinois. So thank you again for joining us. Next, we will hear about the wonderful progress that we're making in mental health services, which is so critical to our community. With Jaquetta Lewis, who is our program manager in for operations and behavioral health, and a panel of partners working with us on mental health. Jaquetta?
Thank you so much, Kimberly. Good morning, everyone, and what a wonderful start to our Mental Health Awareness Month. Good morning. I am so excited and honored to be able to share our progress and celebrate the work being done to provide these deeply needed services. I am here with Dr. Duplantis, Dr. Melissa Duplantis, Chief Behavioral Health Officer at Chicago Family Health Center, which is one of SSHCO's federally qualified health centers, and Carson Swan, Clinical Program Manager of Strategic Initiatives at a Safe Haven. They are both an integral part of the SSHCO's Mental Wellness Initiative. I will share a little background at the SSHCO's work in this space. Then we will engage Dr. Duplantis and Carson into dialogue with me and their goals and the impact that the SSHCO is having on behavioral health and mental wellness on the South Side. SSHCO's Mental Wellness Initiative was piloted at Chicago Family Health Center 2 years ago. A psychiatrist from another SSHCO partner, Sinai Chicago, is subsidized through SSHCO and dedicates Tuesdays to seeing Chicago family patients virtually. Among his many wonderful skills and traits, Dr. Travis Amengwal has expertise in trauma-informed care, so Chicago Family refers more complex patients to him. So far, through this dedicated pipeline, we have impacted more than 1,000 patients. In big picture, what we are seeing is less emergency room visits by Chicago family behavioral health patients, stronger medication adherence, and less stigma in asking for help. After working with Dr. Amengwal, some of our patients are moved to self-sufficiency, scheduling their own appointments. For instance, SSHCO plans to expand this program this month to Beloved Community Family Wellness Center, dedicating another day of week to their patients, and we will be able to keep expanding. We're so very excited. Dr. Duplantis, you've been included in the SSHCO program since the beginning. Tell me what you are seeing.
Thanks to Clara, we see many, many benefits of this program for our patients. The shared resource of Dr. Amengwal is just fantastic. It allows Chicago Family to do much more for our patients with complex needs. Specifically, Dr. Amengwal has a unique perspective on trauma, and often that can make a difference in medication adherence just by switching medication for patients that deal with depression, anxiety, and plus post-traumatic stress disorder. We screen every patient that comes into Chicago Family Health Center for depression and stress. And when we, which means our behavioral health providers or psychiatric NPs, when we escalate a patient to Dr. Amengwal, he reconceptualizes the patient with a brand new set of eyes. And again, with his trauma expertise, he recommends medications that would better control their symptoms.
So, Dr. Duplantis, how has that improved care for Chicago family patients?
Thanks, Jaquetta. In so many ways.
Absolutely.
Dr. Amengwal not only recognizes trauma and prescribes medication, but he really builds a relationship with each patient. The patients have great trust in him, and it increases the support the patients receive through Dr. Amengbal and also through the two dedicated SSHCO community health workers that work with us on scheduling patients and addressing social determinant of health needs. So the patients are really, we wrap our arms around the patients with many team members to provide more support. So with that, we've seen better compliance with taking medication. And as I shared earlier, when we give the same screening to patients monthly around, or actually it's every visit, around depression and stress, we are sort of watching those scores go down, which means their symptoms of depression, anxiety, stress are decreasing and their clinical outcomes are better. Our patients are feeling better, sharing that as our patients work with these important services, it's really important to highlight that it's working to improve clinical outcomes.
So above and beyond the successful work the SSHCO has been doing through Chicago Family and Sinai, and we are expanding that work to other clinics, we are looking to have an even deeper impact on the critical needs in our community around behavioral health. We have recently established a partnership with a safe haven, which focuses on intensive outpatient psychiatric support and services, to launch SSHCO's Crisis Connection to provide on-site clinical interventions in hospital emergency rooms on the South Side. We just started Crisis Connections this week at one of our provider sites, Jackson Park Hospital. Carson, can you share a little bit about how this works?
Yes, thanks, Jaquetta. Good morning, everyone.
Sure.
Happy first day of Mental Health Awareness Month. I'm really excited to share about this program. For those who aren't familiar, Safe Haven is a large-scale social enterprise that's focused on restoring hope and opportunity in our community through housing, workforce development, case management services, and outpatient behavioral health services as well. Our main campus is a 400-bed co-ed temporary shelter with all of those services available on site. A Safe Haven has partnered with SSHCO to launch an emergency department-based program at Jackson Park Hospital, as Jaquetta shared. So actually starting this week, we're really excited to share that it has finally launched. So we will have our hospital-based clinicians located in the emergency department at Jackson Park Hospital. They'll work a split shift, 11 to 11, and we're aiming for coverage all days. So the goal is to intervene when somebody comes to the ER in any form of behavioral health crisis, and provide them on-site clinical intervention resources and make sure that they're able to get the help that they need, where they need it, and in a more efficient manner. So this is going to look a lot like discharge planning, housing, case management services, and scheduling appointments for further support that's needed.
Thank you so much for that, Carson. So the SSHCO is very excited about this plan, and we also hope to scale it up soon with your help, moving this on-site intervention into more ERs who have the highest needs for these services. Carson, can you tell me more about what people can do generally, even on their own, to build resilience in their mental health?
Absolutely. So I am also a licensed clinical social worker and a therapist myself. So I am a little bit biased, but I will say that every single person can benefit from talk therapy. We all need help and support to realize the best version of ourselves, regardless of what our circumstances might be. Similar to your physical health, if you don't exercise your mental health, it won't improve. So some things that I often share with my clients as a major focus would be look into your strengths and really focus on those. Practice your affirmations, leverage the existing coping skills that you have, and learn new ones. Ones that I try to do are breathing exercises, turning off my phone, particularly before bed, getting some fresh air, getting to the gym and exercising. So some of the best coping skills I've seen outside of that would also be music, and a really big one is leaning on your faith and spirituality.
Thank you so much for that, Carson. Those are great. Thanks for sharing. I'd like to ask one additional thing. Are there any additional thoughts to share?
Does that mean?
Dr.
I
Duplantis,
would
thank you.
like to definitely echo what Carson said. I do firmly believe and say this all the time that literally everyone can benefit from talk therapy. I do want to comment on something else that Carson said. There is a huge connection between mental health and physical health. Um, when, sorry, when you have a swollen knee, okay, you might ice it or elevate it. You're going to go to your primary care doctor because you want to know two things. One, what's wrong with me? And two, what can we do about it? You might get a referral to orthopedics for an x-ray or a consult. It's the same thing with mental health. And we truly believe that at Chicago Family, that everything is connected. And the SSHCO.
I think you went mute, Dr. Duplantis.
Sorry. So it's the same thing with mental health. We want at Chicago Family, we screen all patients for stress and depression. And definitely it is important to doc to your primary care doctor if you're experiencing stress, because we know that stress, anxiety, depression can cause physical problems or make them worse, and vice versa. And so at Chicago Family, we teach our patients to change their behavior to help manage their symptoms, like the coping techniques that Carson just shared. And taking medications and keeping talk therapy appointments is also important, because sometimes you need an extra layer of help. We want to keep people out of the hospital, but if that's necessary, we also encourage going to the hospital. Because of the SSHCO Mental Wellness Initiative, we're able to manage most of these mental health needs at Chicago Family Health Center in our patient's medical home. Given that at Chicago Family, we don't do traditional hour-long weekly therapy, we teach self-management through Dr. Amingwal and the other resources at the SSHCO. We can connect those patients with traditional therapy or higher level of care, and we're able to do so from the patient's medical home. Chicago Family was the first program for SSHCO in the mental wellness program. We have learned a ton of things that will shape the future as SSHCO expands the mental wellness initiatives to other Southside clinics, and I'm really excited about that future.
Thank you so much, Dr. Duplantis. Carson, any last words?
Yeah, absolutely. I'd just love to share how grateful we are at a Safe Haven to the SSHCO team that we've been working with, and all of the support that we've received in order to initiate this program in the ER with Crisis Connections. And we're really excited about the impact that we can have moving forward.
Thank you both so much for being here today and all that you do for the SSHCO Mental Wellness Initiative. Let's take a moment and ask all of you who are on our virtual audience today. Think about your own mental wellness and some of the tips that that you guys would like to do for a de-escalation, stress, and anxiety. What are some things that you do to cope? Or did you learn some things today that you might try to improve your mental wellness? Some of the things that I like to do are just some examples for you all. That we like you guys to put one-word thoughts in the chat. Some of the things that I like to do would be yoga. Art is another example. Prayer, like Carson mentioned, and also mindfulness. So I'd like to just highlight that mindfulness is a state of being present and aware of one's own thoughts and feelings. And it's a current moment without judgment. It's also cultivating a non-judgmental and compassionate attitude towards one's own inner and outer experiences. So I see you guys have meditation, we have music coming in, exercise, gardening, reading, affirmations is a huge one for me. I also see dance. We have taken walks. We have being in a happy place, jogging, church, quiet time. That's a wonderful one. And now I want to turn it over to my SSHCO colleague, Thaddeus Wright, to talk about the housing support we provide and what it means to good health. Thaddeus?
Thank you, Jaquetta. Hello and good morning, everyone. My name is Thaddeus Wright, and I'm the Social Determinants of Health Program Manager here at SSHCO. As many of you know, social determinants of health play a huge role in people's overall health and well-being. These are the non-medical environmental factors in a person's life, like where and how they live, their education, employment, physical environment, social supports, and access to nutritious food and quality healthcare. SSHCO knew early on that these circumstances in anyone's life make a huge difference in their long-term health and well-being. So one of the main aspects of our work is to connect people to free services through community partners that SSHCO funds, namely transportation to and from medical appointments, job counseling and training, nutritious food, emergency financial services, and housing support. Over the next few minutes, I'd like to highlight SSHCO's Housing Navigation Program, helping Southside community members covered by Medicaid or without any health insurance who need temporary housing to get back on their feet. Temporary housing serves as a critical stepping stone to helping individuals move toward long-term stability. SSHCO connects people to housing navigators who then work with them long-term toward a more permanent solution to meet their needs. Since our housing services support began, we have housed 77 individuals, each with a unique background and reasons for needing support. Some residents came to us due to homelessness or unsafe or damaged housing or other personal challenges. Our housing program is a beacon of hope, providing positive steps forward in their journey. On average, it takes just a little over a month, about 38 days from enrolling in the program to receiving the keys to their new home. The length of time someone stays in their housing programs varies based on their needs. And so the typical length of stay is somewhere in between 3 months to a year. Our housing support is designed to help individuals successfully transition into securing and maintaining their own housing long-term. Here, you can see we place residents in secure housing options across the zip codes on the south side of Chicago. Some live with their families in a household ranging from 1 to 6 people. While in housing, individuals are actively enrolled in SSHCO services. The residents receive health care and assistance with appointments to their identified primary care physicians. They also have access to the SDOH services that we offer that I mentioned before, including employment assistance and job training referrals, rental and utility assistance, nutritional support, transportation to and from job interviews and medical appointments. For instance, for job training, we work closely with SSHCO's community-based partner, Phalanx Family Services, who is located on the south side of Chicago. Through Phalanx, we connect them to trusted partners who provide workforce development programs, helping them prepare a resume, building interview skills, and ultimately long-term employment. And so obviously having a good job, it makes a huge difference in being able to secure stable housing for the long run. And a good job with benefits can also make a difference with access to health insurance. So now I'd like to share a testimonial from one of our patients, someone who has been a part of our housing program and wanted to share their story.
Connected to PCA Health and gave me a phone call. Basically, Miss Jackson used to inquiring about housing, how they can help me. Gave me a phone interview for application for housing. So within 45 days, I'm in an apartment. They also helped me to make sure I get all my doctor's appointment, nutritionist, and my apartment's input because the house got damaged. I was staying in mold and stuff like that. So it just turned my whole life around. Everything's up. It's been a beautiful experience. It's been a great experience for me. Very happy. And they did a comparison to other programs, stuff like that. This program's hands down. Self-fried, healthy community organization, hands down one of the best ones in the cities to me. They're very consistent in things they do. They make sure you take your medicine, make sure you do everything the doctor ordered, and I get a call every week. Some other organizations did not do follow up on their patients. I give credit to Ms. Jackson, Mr. Vine, for doing an excellent job with me. And I really appreciate them. I've been recommending people to contact the organization every time. Where you get to the help man from? Southside, healthy community organization. I know what the experience did for me, saved my life. Yeah, they have. Amazing job they are doing for the community. So they gave me a great new start, and I appreciate it. For the housing as well as the health-wise.
As you can hear from his experience, this program truly makes a difference. It's about more than just housing. It's about dignity, opportunity, and hope within the Southside communities. And now I pass the baton to Desiree Connectus, a nutritionist SSHCO is subsidizing to work with our patients to share more about food and the role it plays in good health. Desiree?
Good morning, everyone. Thank you for having me. So my name is Desiree Connectus, and I am a registered dietitian with Virtual Health Partners, which educates and empowers residents with the tools they need to make healthier nutrition choices and manage chronic conditions more effectively. We are proud to be part of the SSHCO network, working together to improve the health and wellness of our Southside communities. Today, I want to speak briefly about something we all feel the impact of, but don't always talk about directly, which is the connection between nutrition and chronic disease and how that connection is shaped by the neighborhoods that we live in. So on the South Side, many of our communities are considered food deserts. That means that fresh, healthy, affordable food just is not easy to come by. There may not be a grocery store nearby, and if there is, prices may be high or the selection may be limited. So instead, families are often forced to rely on what's available, which would be corner stores, fast food, and ultimately highly processed foods that are full of sugar, salt, and unhealthy fats. This becomes not just a matter of how convenient it is to access healthy foods, but it becomes a health issue, a public health issue, because over time, these foods can contribute directly to things like diabetes, high blood pressure, heart disease, and can even cause complications during pregnancies. So what we do at Virtual Health Partners is we believe that food is one of the most important, most powerful tools we have to prevent and to manage chronic disease, but only if people have access to these healthy options and know how to use them. This is why we have we are in partnership with SSHCO, and we have launched a two-tiered program. So tier 1 is for people who are facing this food insecurity. We provide support that includes healthy meal benefits along with virtual education available through our online platform, mobile app, email, and text. Participants are able to choose between fully prepared meals or curated produce and pantry boxes. Those living with chronic conditions collaborate with a dietitian to decide which option would best suit their needs. The prepared meals are fresh, not frozen, and they are easy, ready to heat in the microwave. Each menu is thoughtfully designed to support specific health conditions such as diabetes or high blood pressure. We try to go beyond generic advice such as eat fewer carbs and instead help patients understand how nutrition affects their condition, and we give them the tools they need to make changes that they can stick with long term. We focus on practical strategies for making healthier food choices with what they have available and how to do it affordably and consistently. We are currently serving 156 people in this tier. Tier 2 is for individuals who are already living with diabetes, high blood pressure, or navigating pregnancy. So it's not just about eating better. We need to teach them how to use food and how it can become a form of medicine. We are currently working with 186 people in this tier. I wanted to share a quick story about one of our members. So one of our clients, Sonia, came to us with a complex medical history, high blood pressure, high cholesterol, prediabetes, and had recently been diagnosed with congestive heart failure. When we began working with her, her blood pressure was dangerously high, and she was struggling with her weight. Through one-on-one sessions with her registered dietitian, Sonia was then able to learn how to build balanced meals, stick to regular meal times, boost her vegetable intake without breaking the bank, and she now receives monthly deliveries of fresh produce and pantry staples that are helping her to keep up with these diet changes. Since joining the program, Sonia's blood pressure is now under control. She has lost 6 pounds. She's made major changes to how she eats, and she's cooking more at home and cutting back on fried foods and sugary drinks, which are all supporting her health and, more importantly, her medical conditions. She's told us that the produce boxes allow her to have ingredients she simply could not afford otherwise. And we are very proud to support Sonia as she continues with this journey to better health. It's kind of like giving a person a fish versus teaching them how to fish. Giving someone a meal might help today, but when we can provide them with the nutrition counseling and education, we are teaching them how to nourish their bodies for a healthier life long term. We're very honored to be part of the SSHCO family because this work isn't just about this organization, it's about all of us working together. And I just wanted to share a quick video that demonstrates how a little knowledge and a few simple changes can really make a difference.
This one, as I mentioned, has 65 grams of carbohydrates, all added sugars. This one is 52 grams, which is a lot. However, it's 52 grams of all natural sugars. Okay, so yes, this is better. As Monica mentioned, you may be getting fiber, you might be getting vitamins, minerals with this because it's a natural sugar. I like this drink for if you don't really like to eat the fruit, or maybe you don't have a lot of access to fruit. I will say, like, you know what, buy one of these, but drink like a quarter at a time. Because this has 3 apples in it, 1.5 bananas, 10 1/4 strawberries, and a hint of orange, it says. This is now 3, 10, 11, 12, 13, 14 to 15 servings of fruits that maybe if you can't have, you can have this instead. So I'll be like, you know, have a couple of servings of it. That's still okay, but you cannot have all. Is there any added sugar in there? This one is 100% natural sugar. So that's the thing, is that we've got 100% added sugar, and then we've got 100% natural sugar. So if you were going to choose between the two, I'd go with this guy.
So if you guys would like to learn more about our services, all you need to do is speak with an SSHCO community health worker or your physician so that they can give you information and you can be referred to work with virtual health partners. Thank you so much.
Wow. Thank you as well. Learning more about these things that can impact our health. I truly believe that food can totally and is totally medicine. One more reminder to everyone, if you have any questions that you want to ask, please put them in the chat addressed to Bria Kelly. And so one more quick update, and then we'll go to as many questions as we can in the remaining time. Please welcome Dylan Azadi from our Community Advisory Council. Dylan will be sharing some exciting news about our 2nd annual Empowerment Health Fair. Dylan?
Thank you very much, Kimberly, and good morning, everyone. It's great to be back here with all of you. And thank you, Desiree, for that overview. It's amazing work that you and your team are doing. So just to share a quick couple of updates on our 2nd annual SSHCO Health Fair. This is really exciting. This is, again, our second year running. Last year was an amazing success, and we thought we would continue it and even continue to build upon it. So as Kimberly mentioned, I'm a member of the Community Advisory Council. Many of us are on the planning committee for this health fair, as we were last year, to get the guest speakers, the giveaways, and all of the different activities that are going to happen planned and scheduled. So quickly, let's take a look at a video recap from last year. And there's also a QR code in there so you can RSVP, which is totally free, no charge to attend for this year. Thank you very much. Love the video, love the music. I can't help but bob my head every time I hear that song. We'll leave the QR code up for a little bit if anybody wants to grab it and get the RSVP link. But that just gives you a sense of what we do at these health fairs, right? So at its core, it's all about education and empowerment and connection, getting community members, specifically our Southside residents, including all of you, and our community health workers, together under one roof to hang out and have a good time and learn some things and get access to resources. So we just as last year, we're going to do some fun giveaways, maybe some trivia, some free items available on site that are, sort of healthcare services like blood pressure readings and things like that. We're hoping to do some healthy smoothies. We'll be able to give those out for free while the supplies last. So please do get there early if you're planning to go. Just a quick note on the location. So as you'll see when you scan the QR code, it's on South Cottage Grove. It's in the Chatham neighborhood area, and it's at a facility called the Discover Customer Care Center, which is also called the Shine Bright Community Center. That's what many of us know it as. That's a beautiful building, and they've been good partners. So we're excited to use their space, and hopefully that's relatively centrally located for most of you. And then the last thing I'll say is that we do want kids to come. So a lot of the topics are very adult focused as sort of the leaders of your family. However, we do want to take care of the kids, and we don't want that to prevent you from coming. So there will be a little, what we're going to call a kids corner in the facility. And we'll have fun activities and games. And we're even going to have the Disney character Doc McStuffins on site. So it'll be fun. The kids can play and learn and have some fun as well. Okay. Thank you very much. Back to you, Kimberly.
Wow, thanks so much, Dylan. I am certainly looking forward to the Empowerment Health Fair. It was lots of fun last year, and I'm sure we'll build upon that for this year. There are big things there are big. I would like to give a big thanks, I should say, to our Community Advisory Council and all of the volunteers from the South Side, helping us always to make sure that the community is centered in every aspects of our work. And I tell you, our Community Advisory Council keeps us honest around the things that we say that we will do for the community and the things we actually do. So thank you so much to the Community Advisory Council. So now we have time for a few questions. Many of you submitted them in our town hall registration, and you can continue submitting them in the chat to Bria Kelly. And I'll turn it over to Krista Hamilton, who is the president of UCAN, and she's also the secretary of the Southside Healthy Community Organization Board of Directors. Hello, Krista. And thank you for
Kimberly. Hello, everyone. Thank you, panel, for such great information today. I'm a proud board member of the SSHCO. I always look forward to these town halls, but I'm going to jump right into our questions. So keep them coming in the chat. My first question, Thaddeus, I think everybody was excited to hear about the housing program. People want to know, how can they refer someone to get assistance and support for the housing program?
Yes, absolutely. So they would just be pretty much connected to their community health worker or their nurse care coordinator. They would request those services then if they are enrolled in our services. If they are not enrolled in our services, they would simply call The number is, if I can find it really quickly, I know out there just submitted it into the chat, is 872-274-4688, or they'll visit our website at www.southsidehealthycommunity.com, and they'll just register using that QR code that's on our website. We actually do have virtual flyers that's being circulated. So there's also a QR code on that flyer as well that they can sign up on as well for our services. And someone will be reaching out to them quickly.
Sounds good. Sounds like you're going to get a lot of calls. This is a wonderful benefit of this organization. Okay, my next two questions, I'm gonna actually compound them together, Lashandria, for you. Do the SSHCO attend community events? If so, how do folks connect to invite you out to speaking events, mental health community events? So how do we get connected and bring you into the community more?
So good morning, everyone. My name is LaShondra Perry, and I am the Senior Manager here at the Southside Healthy Community Organization over the Care Coordination team. So that's a great question. We love to come out into the community with our community health workers, as well as our nurse care coordinators. The best way to invite us is to touch base with Thaddeus Wright. As he stated, he is the Social Determinants of Health Program Manager, and that also includes community engagement. So Thaddeus is that person to reach out to. And if Thaddeus could you please place your email within the chat so that the community members who would like to invite us out can definitely contact you.
Yes, I'm right on that.
Thank
Absolutely.
you.
I've actually started receiving emails right now. So, hey, Geraldine, I see a lot of familiar faces on this call. So, looking forward to hearing from you all.
We should have led with your presentation. It got the people excited. The next question is for Carson. One of our attendees wants to know, what are the eligibility requirements to refer patients to a safe haven?
So the current referral process is only for patients that are presenting to the ED at Jackson Park for the Crisis Connections program. If it is just for a safe haven services, for housing, you would have to go through 311. But for community resources, we offer outpatient behavioral health, so mental health and substance use, and then workforce development. I can put our website in the chat, which has most of the information available.
All right, thank you, Carson. Kimberly, our next question. One of our attendees wants to know, there's so many things going around about Medicaid. People are very concerned and nervous. You mentioned a lot of our patients for SSHCO use Medicaid to get these services. They want to know, what if they're dropped from Medicaid or no longer exists in Illinois? So please share with us what's some advice.
Yeah. Yeah, given what's going on, I know that we have heard of all of the, uncertainty around Medicaid and around what could happen and what might happen. And I think just uncertainty alone brings about a lot of anxiety in individuals wondering what will happen if something happens to their Medicaid. And so I just want you to know that the SSHCO continues to be focused on the work that we do. Our budgets are approved by the state of Illinois. We have been encouraged to move forward with our work, and that is just what we're doing. But what I do want you to know is that there are opportunities for individuals that may have no Medicaid. There are free clinics. There are several free clinics that are available in the Chicagoland area and beyond. Also, federally qualified health centers are somewhere that uninsured and Medicaid patients can go. Federally qualified health centers, and they actually see patients regardless of their ability to pay. And our most free clinics, the only requirement to go to a free clinic, many of them, is that you don't have any insurance. And so those are opportunities for individuals that may be impacted if we see some type of extreme issues with their Medicaid.
Sounds good. Thank you, Kimberly. I'm going to jump over to Jaquetta or Carson, either one of you. How can mental health programs assist with Chicago crime? That is on top of everybody's mind. If one of you could pop in and just give us some tips.
Yeah, thank you so much. It's important to understand that most people with mental health are not violent. nor does that predict criminal behavior. Our focus is on mental wellness and helping Southside residents holistically with better physical and mental health.
Carson, did you want to add anything?
I second that notion. One thing I'd also love to share is that oftentimes people that are victims of any form of Chicago crime could be more prone to developing post-traumatic stress disorder, which is something that Dr. Duplantis touched on as well. And that's that's definitely something that can be treated through talk therapy and other behavioral health resources.
Thank you all. Thank you. LaShondra, we got a question for you, and it's maybe from one of our hospital partners. They said one thing our clinic struggles with is patients not showing up for their medical appointments. Usually it's a combination of all the factors that they've talked about today, the barriers. How can we refer these patients to the SSHCO to help get support, to ensure that they're making it to their appointments and receive the treatment that they need?
Oh, great question as well. Our focus is to make sure that those patients are getting to their appointments. So our community health workers and our nurse care coordinators, they are often calling to identify, well, what are the barriers of getting to that appointment, and or placing reminder calls to say, within a week, you should be attending that appointment. The day before, is there anything that could prevent you from getting to your appointment? So there are a plethora of ways that we are utilizing phone calls as well as text message to help those patients with those appointments. And as Thaddeus stated, with providing transportation to the appointments. Now, to refer those patients to us, you are able to refer those patients to our website, which is www.Southside Healthy Community Organization. I'm sorry, Southside, www.southsidecommunityhealth.org. And I may be saying it incorrectly. I'm so sorry, but I'm for certain we will have it in the chat. We also have the phone number that will be placed into the chat. And with that phone number, we have community health workers and nurse care coordinators who are able to answer the phone call. If those calls come through after hours, we also have a ability to respond to those patients within 24 hours. So please, please, please provide the patients with the website and or with the telephone number so that we can contact those patients directly.
Thank you so much. We are coming up on time. I have one more question. I'm gonna do a little bit of a merge of two questions here. What is on the horizon for expansion for the SSHCO? And then can somebody just list like the exact services? Because we talked about so many things today. If we can list out the exact services of the SSHCO, it's always a mouthful to say that. So maybe Kimberly or LaShondra, you want to take that?
Sure, I can go ahead and take that, Kimberly, on.
Oh, Kimberly, you were muted. You started talking. Okay, you muted yourself again, Kimberly.
I don't know why
Kimberly.
I don't know why my computer keeps doing that, but yes, I will start, and then LaShondra, you can drop in. So as you've heard, we have a lot of services that we provide to the community. We have mental health services. We provide education around how to navigate your health care. We are also in 21 sites on the south side of Chicago. We have just started maybe 5 or 6 months ago a community engagement team that is not necessarily in the sites, but we are expanding on the ground in the communities. If we have a patient that we're serving and we can't find that patient to follow up with that patient, we are actually on the ground, door knocking, going to individuals' homes, trying to find these individuals so that we can get them where we need to go. You've also heard about our maternal health program, our mental health program. We also have a hypertension program, and we'll be starting a diabetes program. And so our goal is to pilot many of those programs. Maternal health has already been launched, and we are going to be scaling these programs across our 13 partner organizations on the South Side. And so that's really exciting news to know that we'll be not only having these programs in one place or two places, we will be scaling them across the South Side. And so we just continue to be excited about the work that we're doing, the partners that we have on the South Side, our Community Advisory Council, and our Board of Directors that helps us to stay honest on our promises to the community. LaShondria, I'll turn it over to you.
Absolutely. So all of that Kimberly has stated, as well as working with the insurance companies who supply our patients with Medicaid. So helping by contacting patients from Aetna Medicaid, County Care Medicaid, so many of the Medicaid partners within Illinois to say, hey, let's get these patients in for their annual wellness appointments. Let's get these patients in for breast cancer screenings. Let's get these patients in to provide the maternity care that's needed pre and postpartum to work towards those initiatives that the Priska Foundation has as well.
Well, I think that will do it for our Q&A portion of our town hall. Kimberly, I will pass it back over to you to close us out.
Yes, I would like to just say thank you so much to everyone for being here with us today. It's always fun and exciting to have these types of town halls, so we can update everyone on the work that we promised and the work that we're actually doing. I want to encourage you to stay connected with the SSHCO for more events and resources that we're having. I want you to follow us on our social media. And visit our website at southsidehealthycommunity.com for updates. Feel free to contact us as well on our phone number, which is 872-274-4688. And please, please continue to get the word out about the Southside Healthy Community Organization, or the SSHCO, so we can continue our work in building a healthier South Side of Chicago. Thank you again, and have a great day.